I'd like to ask to join us Meghna Talekar, and she will tell us about breaking the wall of translating nanoparticles to immunotherapy.
Thank you. Hello, everyone. I'd like to start my talk by introducing you to Renee Lang. She was one of the 12 people who described her experiences of living with a condition called rheumatoid arthritis. Renee was only in her 20s when she was diagnosed with this condition, and that diagnosis made a significant impact on her life and also her career choices. What I hope to do today is to discuss with you how we're working to break the wall of generating next-generation immunotherapies for people like Renee, and therefore better treatment options for rheumatoid arthritis. So, what is RA? RA is a debilitating autoimmune disease that is characterized by pain, swelling, joint stiffness, limited movement of the affected joints, and in severe cases, if it actually goes untreated, can cause disability. Globally, millions of people are currently affected by RA, and in Australia alone, close to 500,000 people already suffer from this condition. What's worth noting is that with an increase in an aging population, it's very likely that the numbers are going to continue to increase. Now, currently, clinicians have a range of therapeutic options that are available to them, and they do provide symptomatic relief. However, because they're non-specific, they do cause toxicity, and therefore there are compliance issues. What's also worth noting is that they're quite expensive, and so we need to come up with better therapeutic alternatives. So, moving forward, we need to focus on two things. We need to develop personalized therapy that has reduced costs associated with it. Now, what we know about autoimmune diseases is that it's your body's defense cells that are actually causing the self-damage inappropriately by recognizing the self-tissue inappropriately. And so if we can retrain our immune cells, there is a potential of stopping that degree of self-damage. So with that strategy in mind, back in 2015, we developed a vaccine-style therapy called Rheumavax, where what we did is we harvested the patient's immune cells, gave them the right messages in a plate, and then re-injected them back into the patients. Now, that strategy proved to be quite effective. However, going long-term, that was not going to be the most cost-effective approach. So we decided to re-strategize and went for a nanoparticle-based delivery system, which is liposomes, which are essentially tiny fat bubbles. And these bubbles allowed us to package our messages for our immune cells within these delivery systems, which could be directly administered to the patients. So with something like this, we have now been able to package our liposomes into a tiny vial like that can be immediately administered to the patient. And then going forward, we really hope to use something like this to help people like Renee and break the wall of treating autoimmune diseases. Thank you.
Thank you, Meghna. There's a question over here.
Thank you. I was part of the team that launched Enbrel in Australia. How do you propose that this particular technology would be any more cost-effective than Enbrel or other classes of drugs?
Absolutely. So focusing on something like Enbrel, the way this strategy would work is we're hoping to actually give a vaccine-style therapy. So we're hoping to either have it as a treatment or a preventative measure. So the relative amount of doses that you require would be far less. The other issue is that liposomes have been extensively used now for the past 15 years. So the manufacturing and the regulatory information that's available with that is already quite advanced. And so we're hoping that that should help in bringing something like this to the table, not only for rheumatoid arthritis, but also other autoimmune diseases.
What kind of nanoparticles are you using for these studies? And I was curious to know if they have biodegradability.
Yep, so we're using lipid-based delivery systems, which are liposomes, and they are biodegradable systems.
Okay, thank you for the discussion and the answers, and thank you, Meghna.